Hello and welcome back to GP Video Podcast by Nadia. So as I promised, I'm going to now make regular video podcasts again. Now that I am health-wise feeling a bit better and a little bit less busy today at work. So let's just do it. So today the topic that I'm going to talk to you about is called gastroesophageal reflux or heartburn. Okay, and which age group I'm going to talk about? I'm going to talk about infants. Who is an infant? Any baby between 0 to 12 months. So up to 12 months, a baby is called an infant. So I'm going to talk about gastroesophageal reflux disease in infants. Now, there is a clear demarcation or a clear difference between gastroesophageal reflux and gastroesophageal reflux disease. And what is it? I'm going to read out for you RCH guidelines, and RCH stands for it's one of the hospitals, Royal what? It's one of the hospitals, Royal Children's Hospital in Melbourne. Okay, so RCH guidelines are quite the gold standard guidelines for health professionals for children health. So I'm gonna discuss with you RCH guidelines about gastroesophageal reflux and gastroesophageal reflux disease in infants. Who is an infant? Any baby up to 12 months. So, gastroesophageal reflux is the passage of gastric contents into the esophagus, often with effortless vomiting. It is a physiological process that occurs several times a day in healthy infants. I'm sure all the mothers know that the babies have this reflux kind of thing in which they just regurgitate milk back, and it happens several times a day. How many ever times you feed a baby, it can happen with that. Gastroesophageal reflux is common, affecting at least 40% of infants. So if there are 100 babies, 40 of them would definitely have gastroesophageal reflux, which is a physiological process. Again, I'm telling you here that I'm not talking about gastroesophageal reflux disease. I'm talking here about gastroesophageal reflux itself. It usually begins before 8 weeks of age, like before 2 months, peaks at 4 months, and resolves by 1 year of age in majority of cases. So that's why I'm talking about infants, because it is most common in infants in the kids group. So it usually begins, the physiological gastroesophageal reflux, it usually begins before 2 months, peaks at 4 months, and usually resolves by 1 year of age. It does not cause crying and irritability in healthy infants. Infant crying peaks at 6 to 8 weeks, and hence some babies with simple gastroesophageal reflux may also be unsettled. So the physiological one should not cause unsettling and crying and irritability, but because infant crying peaks at 6 to 8 weeks, which is when the gastroesophageal reflux starts as well, so it can be confused for crying of the infants. This one rarely requires investigations and can be usually managed with parental education, support, and anticipatory guidance. Now, what is the difference of gastroesophageal reflux with gastroesophageal reflux disease? Gastroesophageal reflux disease is when gastroesophageal reflux causes vomiting with refusal to feed, pronounced irritability with feeding, aspiration, chronic cough, wheeze, slow weight gain, and bringing up vomiting blood. So this is when we call, now this is not physiological or normal gastroesophageal reflux, it is actually gastroesophageal reflux disease. Then another good point here is that cow milk protein allergy can present with symptoms similar to gastroesophageal reflux disease. Now, when we talk about assessment, both gastroesophageal reflux and gastroesophageal reflux disease can be diagnosed on detailed history and examination. Direct observation of a feed by an experienced clinician can be particularly useful to identify any exacerbating factors. Alrighty, so as I said, today we have discussed that gastroesophageal reflux, which is the usual physiological reflux or the usual normal reflux that happens around in 40% of the babies when they regurgitate milk after feeding, is usually common. It's as common as 40%. It usually starts before 2 months of age, peaks at 4 months of age, and settles down by first year of age. But when it causes vomiting with refusal to feed, pronounced irritability with feeding, aspiration of the feed, chronic cough and wheeze, slow weight gain, and vomiting up blood, then it is termed as gastroesophageal reflux disease, and then it needs definitive management. Gastroesophageal reflux usually does not need any management. It just needs parents reassurance, and then burping them nicely, and then just all the other techniques that are there for that. But gastroesophageal reflux disease definitely needs management and medication, most probably. And what is the medication? How do we manage gastroesophageal reflux disease? I will talk to you about it in my next podcast. See you guys then.